Hello everyone. I'm here to tell you the story about my procedure that I had done. So I have to start from the beginning so you can understand. I know I don't have to tell my business, but I'm telling my story because I know other people go through these things and they may be going through this at this time also. Okay? So it's for women, but it's for men too. So let me start from the beginning. So ladies, when I started changing life some years ago, I noticed that I had to urinate a lot. I had a lot of UTIs. I kept going back and forth to the doctor. They kept giving me antibiotics. Nothing was straightening this thing out. So when I got sick last year, even in the hospital, I was peeing so much, y'all. It was just so much. I was peeing constantly. When I got out of the hospital, I noticed I still had that problem. My urinary issues got worse. So I said, I better go on and check this out and see what this is about. Doctor said, go to a urologist. He specialized in stuff like that. And so I started to research different doctors. I came upon this doctor and the reviews were very, very good. So I went to an appointment and they tested my urine, my sugar. My sugar was high at that time. And so they said, next time you come, you're gonna have this procedure in the office. So I went, and this lady, she was doing a procedure. I can't think of what the procedure was called. And she put a tube in the front and in the back. It was very uncomfortable. But I went along with it because, they had to find out what's wrong with me. So they sent me also for x-ray. I think it was an ultrasound. And of course, there's no pain with that. Okay. I come back to the office another time and they said, we have to do this procedure. They didn't really explain the full details. I guess they probably thought if they explained the full details that I would back out of it. So anyway, let me move along a little faster. So they put me on this chair and they put this thing up the front. YouTube is funny about things, so they put it in the front. Okay. It was so painful. They couldn't get the tube or whatever that was. No, it wasn't a tube. It was an instrument. They couldn't get that through. So the doctor said, this is the problem here. This is the problem here. Seems like you have a blockage. So he tried. He said, well, I can send you to the hospital and do the procedure there and we put you under. Okay. So, they set it up. It took them a while to get in touch with me. Matter of fact, I had to get in touch with them and set up things at the hospital and stuff like that. Their staff is not really all that good either. So I go to pre-op on the November 21st. I went to pre-op so they could test to see was anything wrong with my heart, whether my sugar was up, a few things. My procedure was scheduled to be done on November 23rd, the day before Thanksgiving. So then my sister lives 2 hours away. She came to take me. She picked up my mom and brought her, and they sat there. And so they sat with me for a while. Only one could sit in the room. And then, then my sister had to go out while they was getting ready to do my procedure. So they hooked me up to the IV thing, at least prepared my arm, right? They take me in a room let's see, these people in there. It was some Asian nurses. They were so sweet and so nice, and they giggle a lot, and they were nice. So then this anesthesiologist asked me some questions, and he said, do you have problems, since I have heart condition, do you have problems walking up 2 flights of stairs without stopping? I said, no. I said, I have to stop and get my breath a little while. So mind you, he's this big guy. He has on his scrubs, but you can see all this chest hair, like 1972. All this doggone chest hair. That's not sanitary and it's not professional. You know, if you're gonna wear that hair, get a better shirt to cover it. So he said, I don't know. So then the doctor, we can do it without anesthesia. It'll just be a local anesthesia where they supposedly numb your area. So I said, well, I want an anesthesia. First of all, you tell me that I'm having anesthesia. Then you set up for the hospital. How you going to put me in the hospital and I can't get anesthesia? So anyway, he started. I was screaming my head off. And this jerk was saying, oh, it doesn't hurt. It doesn't hurt. It doesn't hurt. It's going to take 3 to 5 minutes. It doesn't hurt. And this wicked looking look on his face. Like, you know, like halfway smiling a little bit. You know, he seems like a nice person, but I think he's evil. So, it doesn't hurt. So the nurses, they came around me and they started like rubbing my shoulder, I had a thing on my head, cap on my head. And they started rubbing my hair. Oh, it's gonna be okay. It's gonna be okay. Also, they ran to the thing. I don't know what it is, but it has a screen and it has all my medical history, and they could see all the things that I have been through, all the things I'm treated for, and all that. And they had like a real funny look on their face. So I screamed and screamed and screamed and screamed, and it seemed like a long time to me. It probably wasn't that long, but it seemed like it was to me. And he said, it doesn't hurt. I said, yes, it does. It hurts. So anyway, it was over with. They took me downstairs to the recovery. First of all, it wasn't a recovery because I didn't have anesthesia. So a nurse came in where the so-called recovery area, if that's what you can call it. And she said, right in front of my sister, she said, how are things? I said, it didn't go well because he didn't give me anesthesia. She said, yeah, and a lot of people are back here is talking about that. Because she said, first of all, if they felt that my heart was that bad, they should have sent me to my cardiologist. You know what I mean? Some days before, a week before, or whatever. I had pre-op on the 21st. So if they saw something wrong, when they tested my heart, then why are you tripping in the operating room? You know, sometimes people think that people don't hurt, they don't have no feelings. It's not something that they feel they have to discuss with you. You're going to change them like that. You know, in that case, you should have just did it in the office like you was trying to do. But you changed up at the last minute. You let me suffer. Everybody knew what's wrong with what he was doing. And so you can't even really rely on Google. Sometimes Google is not your friend because I'm sure some other cases, I'm sure I'm not the only one, but it was really, really, it didn't seem right. It didn't seem right at all. So I have to go back to him to get my results. If I don't have anything real bad wrong with me, I'm not going back no more. I'm not going to be subject to your experiment. I'm really not. Because that's what it is, experimentation. They even tried to have me sign something about if we implant something in you and we can track your social security number and this and that. I put a big no. Heck no. You're not going to be sticking stuff in me. First of all, that seems too much like the 666 Illuminati to me. So I didn't. I put no. And if anything comes up crazy, I'm not going to sit back and not do nothing. I got to do something about it. And, I've been having some problems these last 2 years with doctors. My regular doctors, I've been going to like 20-something years. And even though my situation with my heart was kind of dire, they got me. I'm still here. I'm still here. So for somebody, I call him a newbie, but he's not a newbie. He's been a doctor for a long time. But for you to get a new patient and you do that, then you mess it up for yourself. Because I'm not gonna let you just do anything to me. And I'm wondering, are some of these doctors on drugs? What is their problem? I just don't get it. I don't understand it one bit. Because you're not supposed to change up at the last minute like that. And actually, I would have been pissed, but if you had told me, oh, we can't do this right now. But still, if he had sent me to my cardiologist, he would have had all the answers. So it's like it was set up to let me suffer and for him to enjoy me suffering. Okay, so this is for men too, because this doctor has a lot of men patients too. And from what the nurse who works there at his office said, that the procedures are even worse for the men. It's really painful. So if you're a person that don't have a high tolerance for pain, try to go somewhere where they will give you the anesthesia. But if somebody start acting funny and weird, because he had a weird look on his face, then you need to switch to another doctor. Now, if nothing is wrong with me, I'm not switching to another doctor. I'm gonna leave him alone. But what I'm gonna do is, I'm not going to no more urologist, because I would have to get tested for those same things over again, and I'm not with it right now. So thank you for watching, and I will talk to you guys, and take care of your health. Only deal with the professionals that's concerned about you. Genuine concern. Because there's so many now that's weird. So I will talk to you guys later. Bye.